Hey, how's it going, guys? This is Chris. I'm checking in today, letting you guys know about Bell's palsy. We're going to determine how to uh, spot it and look for our diagnosis in the field, what are our signs and symptoms, and how is it caused. So, Bell's palsy is defined as weakness or paralysis of the muscles of the face on one side. It's damage to the seventh cranial nerve, aka the facial nerve, that is idiopathic in its origin, aka unknown. So this will not be from a stroke, a tumor, or facial trauma or head trauma. This is in itself um, an unknown cause. So we can see normal face on the right for this lady, and then Bell's palsy on the left on that right side of her face, where we have an absence of the nasolabial fold. So on this side of her face, there's no fold right here near her mouth. So near her lips, there's no fold. There's a drooping eyelid, so her eye is just wide open right there. And then the drooping mouth to the one side right here. There could be dryness on that affected mouth or eye due to lacrimal, submandibular, and sublingual glands, which are controlled by the seventh cranial nerve, aka the facial nerve. And then there could be hypersensitivity to loud noises and loss of taste to the anterior 2/3 of the tongue, that are all controlled by the seventh cranial nerve. Hey guys, so this is a great thing I found to try to differentiate where the lesion will be occurring that could cause our Bell's palsy to occur. So for this, the peripheral lesion, it's involving the cranial nerve number 7, Bell's palsy. So the nucleus of cranial nerve 7 is right here. And then the lesion will be lower than that. It'll involve both the upper and the lower side of the face. With the central lesion, aka the stroke, there's bilateral innervation. The lesion will usually be in the brain itself, and it will affect just the lower region of the face. So with Bell's palsy, you'll have the entire side of the face will be, you'll have the absence of the nasolabial fold, drooping eyelid, drooping of the mouth, dryness of the affected mouth/eye. You could have the loss of taste to the anterior 2/3 of the tongue, hypersensitivity to loud noises. It's going to be an all-encompassing thing because it's going to affect the entire side of the face, that entire cranial nerve, and it will not be resolved by removing a lesion or a clot or correcting a bleed like a stroke would, or corrected with a surgery like trauma with like brain swelling. So treatment for Bell's palsy, there usually isn't one if it's mild, and it usually goes away by itself within 6 months. Although some people do develop permanent facial paralysis or just loss of motor function on one side of their face. But in severe cases, corticosteroids can be used to try to restore function to that nerve. And the rationale for the use of corticosteroids in an acute phase of Bell's palsy is that the inflammation and the edema of the facial nerve are implicated in causing Bell's palsy, and corticosteroids have a potent anti-inflammatory action which should minimize nerve damage and thereby improve the outcome. So it's like when we're treating an asthmatic that has a super inflamed airway and nothing we're using can help that. Corticosteroids can be used to help them in the hospital setting. So the theory is that you can have lots of swelling on those nerves, and then maybe the corticosteroid could help that. So some viral infections can cause Bell's palsy, such as herpes simplex, Epstein-Barr, varicella zoster, and then also a bacterial infection known as Borrelia burgdorferi, which causes Lyme disease. So those are things to be cognizant of. And then your stroke scale should tell the whole story. Usually, if your patient can clear most things on the stroke scale and you have total upper and lower facial paralysis and loss of motor function on that side, that's probably indicative of Bell's versus a stroke or trauma or a brain tumor. So that's Bell's palsy.